Precision Opinions Live. My name is Christian Stella, and I am a Pharm D. And right now, we are sitting with Sharon George. She is a Pharm D student, candidate 2021. 2021, right?
Yes.
Okay. And she is currently working at CVS. She's getting ready for the future, and which is going to be a lifelong pharmacy dream. So she's been at our rotation this whole month and very passionate about compounding, it seems. And couple of over this month, we had a lot of patients that were coming in for progesterone for fertility, and it was an interesting topic. We kind of ran it off each other, and we were bumping ideas and kind of getting the same mindset of the physicians that are writing these. So I just wanted to go through that. We're going to go through that today. So progesterone, what is it exactly?
So progesterone is a hormone that's in the female body that prepares the body for potential pregnancy after ovulation. And the way it does that is through thickening of the lining of the endometrium to accept the fertilized egg. And another way that it does this is to also prevent muscle contractions, which would otherwise reject the egg. And basically, once the woman gets pregnant and the hormone actually starts to rise, and this happens because you would want this hormone to stimulate blood vessels in the endometrium to help the fetus to grow. And if when the progesterone levels do lower, that's because the woman does not conceive and the corpus luteum breaks down. So once the hormone is lowered, then that sparks menstruation.
Perfect. So I do a lot of menopause consultations. And when we look at these women and we look at the cycles, on days 14, that's when their progesterone slowly starts to rise up. You know, when it gets to a certain point, they're not, there's no sperm, so it completely falls off the endometrial lining, and they go through a cycle. So it's very interesting how if they are fertile, their body will continue to produce progesterone. So now progesterone, we see it in two types. There's a couple different ways it's derived. What would be the difference between a synthetic and a bioidentical?
So synthetic progesterones is also called progestins, and they create similar effects to the progesterone that's in our body. But a bioidentical is different because it actually uses the same progesterone that's in our body, creating the exact same effects that the normal progesterone in our body would create. And it's created from natural sources such as yams and soy. So bioidentical is more natural, whereas synthetic is where you're making it to create similar effects, not the exact same effects.
Correct. And I remember there was a time where they were trying to take the synthetic off the guidelines, but they did a bunch of studies, and now they put it right back on the guidelines. Now, fertility. How do we know? Do we give progesterone to every single patient that's pregnant, or is there some sort of guidelines that we have to follow?
So there's a few things that you would look for to put a patient on progesterone. So some of the things are like when you go to the doctor would draw your levels, and if they one of the things that they measure is how thick the lining of the endometrium is. So if it's like a thin lining, or if the patient has PCOS, a previous loss of pregnancy, or an irregular menstrual cycle, these are some of the things that would cause the doctor to be like, you need to be put on progesterone. And that's because this hormone is what creates the healthy environment in your body for the fetus to continue to grow.
Yeah, perfect. So in some cases, they'll even draw the levels of progesterone and see where those levels are at, because it needs to be high. Mm-hmm. They need to keep the baby safe. So if it's low, substitute with progesterone.
Yes.
Now, when they substitute with progesterone, how is it delivered to them? There's certain different forms. There's IVs, there's capsules. So what would they use, and what's preferred?
Okay, so basically they have, I think, 4 to 5 different forms. It's suppositories, capsules, vaginal creams, and IV, like you said. The gold standard is injections and vaginal creams, and the lesser effective is capsules and suppositories.
Okay. We do inside the lab, very commonly we're making capsules, whether it's sustained release or it's immediate release. We are also making suppositories. As of right now, we don't make injections. Yes. We don't do that, but in the future, within a month or two, we will start. So we see it from all different angles: vaginal creams and topical creams as well in progesterone, bioidentical. Yeah. Now, most common, I would say, that we're seeing is progesterone suppositories. How do we make those?
So for suppositories, you are basically melting the base for the suppository, and then after it's melted, you get the progesterone powder and dissolve it into the base. Once it becomes a one mixture, we're going to pour that mixture into suppository molds and wait for it to solidify, and then it's ready to dispense.
There you go. Once it's solidified, goes in the refrigerator. Yeah. It's all ready for the patient. And that was something that you made quite often, right?
You know, a lot. A lot of them.
Yeah. All right, good. So I want to thank you for coming on. You have a very bright future.
Thank you. Mm-hmm.
And don't lose contact with me, all right?
Yes, of course.
Thank you.
Thank you for having me.
Be sure to search Precision Opinions Live on Stitcher, Spotify, YouTube, and Google Pods. And make sure to follow Precision Pharmacy on Instagram, Facebook, and all other social media platforms.